back, everyone. Cases of the mosquito-borne illness dengue fever are rising in the United States. The Center for Disease Control's issued a warning for spring and summer travelers and advised healthcare providers that cases are expected to rise. Here with us is physician and senior public health contributor for Forbes, Dr. Omer Awan. Doctor, welcome. Good morning.
Thank you. Thanks so much for having me.
Of course, our pleasure. So last year, the U.S. saw over 3,400 cases. That's a record number. Where in 2025, there are over 1,000 cases. What should people know about the virus, and how do we protect ourselves?
Well, the dengue fever is caused by a virus, and there are actually no specific antiviral medications that are used to actually treat dengue fever. So treatment is usually supportive, things like fluids, hydration, rest, and that is used to prevent certain complications like dehydration. Now, it can cause a significant amount of pain, particularly pain around joints, around muscles, and that's why when you have pain, it's important to take Tylenol and not aspirin or Advil, because aspirin and Advil can actually increase your risk of bleeding, and nose bleeding has been a particular complication that has been on the rise with all these cases that you mentioned. So very important to avoid those medications. Now, it's also a mosquito-borne illness, so avoiding mosquitoes, wearing long clothing to protect yourself from mosquitoes, mosquito repellents, all those things can really help prevent dengue fever.
Doctor, why are cases so high? We're just 3 months into the new year, and what are the available treatment options?
Well, they're high because this fever and this infection really thrives in warmer climates. And, quite frankly, we've had, a lot of climate change. And, in general, the temperatures have been warmer and the mosquito is able to thrive, and it's able to go in places that usually before it wasn't present. So this climate change is really having a real profound effect on the virus and its ability to cause transmission of disease. So treatment, again, is very supportive, really, rest, fluids, hydration, very supportive therapy to treat certain complications like pain and dehydration.
Let's move on to Alzheimer's disease. This is very exciting. There's an experimental drug. It's making headlines. We should mention it's in its early trials, but the drug cut the risk of people genetically destined to inherit the disease by up to 50% in some cases. Doc, what is different about this treatment compared to other available drugs out currently?
Well, it's very exciting, and I think it's interesting because the medicines, the new medications are targeting a specific protein called amyloid. And amyloid, we know in Alzheimer's disease, is in larger amounts of numbers. It's an abnormal protein that is linked to Alzheimer's disease and Alzheimer's dementia. So this drug actually targets this protein and decreases the amount of this protein in the brain and the body. And that can be a new revelation for this specific disease. So really exciting, and I'm curious to see how this spans in the long term and whether or not this is going to be a real difference for many patients.
It'd be really exciting if it eventually hits the market. March, Colorectal Cancer Awareness Month. This is another headline. Doctors are seeing an unusual trend of people under the age of 55, very young people being diagnosed with colon cancer. What's behind this rise, sir?
Well, we don't exactly know, but one thing that we want to really monitor is that there is a direct link between obesity and colon cancer. And remember, 3 in 4 Americans are either overweight or obese. So certainly this is contributing to the rise of colon cancer, particularly in young individuals. And other risk factors, we talk about smoking, alcohol, these are major problems in America. So I think if we modify some of these risk factors, we can do better and hopefully decrease the wave of increased cases of colon cancer throughout America.
We're seeing some prevention tips that you mentioned on our screen, but how do young adults stay vigilant? Is there preventative testing, or is there anything people can do to lower their risk factor?
Absolutely. So the best thing to do is to get screened for colon cancer, and that starts at the age of 45. Typically, you get screened with a test called a colonoscopy. That's usually a tube that a doctor puts in through your bowels where they're able to visualize your entire colon. Very important to do that because through screening, we're able to catch cancer before there are any symptoms. But other than that, watching our diet, we know that colon cancer is associated with low fiber, high fat diets, with ultra processed foods, red meats, to avoiding those type of foods, maintaining a healthy diet where we watch our weight, and also avoiding alcohol, quitting smoking. All these things will be instrumental in decreasing one's risk of colon cancer.
And Doc, we're running out of time, but I do want to ask you about researchers from the UK. This is a lot of us are interested in this story because these scientists are reporting that staying up late can increase your risk of depression for all those night owls out there. How does poor sleep factor into mental health?
Huge, huge. We know, and through a lot of research, that decreased amounts of sleep will affect your mental health negatively. It's important to increase our quality of sleep. And the way we do that is to bolster our sleep hygiene. Things like maintaining a cool, dark area, avoiding caffeine and alcohol before we go to sleep, avoiding screens. That's a big thing that we often don't do, where a lot of us are on our phones, but, the light on the phone can really activate certain parts of our brain that prevent us from sleeping well. And the other important thing is exercise. We often don't talk about that enough, but research consistently shows that those with higher quality sleep exercise regularly compared to those that don't exercise regularly. So really important for us to get out there and move our bodies.
All right, great advice today, Dr. Omer Awan. Thank you. I know it's your first time on the show. We really appreciate it. Thank you.